the initial results of the CheckMate 9ER trial were presented first at ESMO 2020 during a presidential symposium as part of the main ESMO program. And these results demonstrated benefits with the combination of Cabometyx and Opdivo across efficacy endpoints in a representative population inclusive of all IMDC risk groups. This included median progression-free survival, the primary endpoint, which was double with the combination versus sunitinib, 16.6 months versus 8.3 months. An increase in overall survival demonstrating 30% reduction in the risk of death when patients were treated with the combination, and objective response rate, which were 56% versus 27% respectively, as well as a longer duration response with a tolerable safety profile. Further data were subsequently presented at the ASCO GU conference in 2021 at a median follow-up of 2 years, which demonstrated that these efficacy benefits were sustained with longer follow-up. And in addition, these data were reinforced by new health-related quality of life data, which demonstrated that patients treated with a combination of Cabo-Nivo reported significantly improved quality of life versus sunitinib. The new data to be presented at ASCO GU 2022 focus on updated results from the pivotal CheckMate 9ER phase 3 study evaluating Cabozantinib in combination with nivolumab in previously untreated advanced renal cell carcinoma, being announced this Saturday. The key takeaways from the ASCO GU 2022 data are the continued efficacy and tumor shrinkage benefits with Cabometyx in combination with Opdivo compared to sunitinib in the first line of advanced renal cell carcinoma. The final overall survival analysis data were presented at ASCO GU conference with a median follow-up of 32.9 months. And this new data demonstrated that Cabozantinib in combination with nivolumab continued to show superiority compared to sunitinib across all the efficacy endpoints evaluated, including overall survival, progression-free survival, objective response rate, and disease control rate, including increased complete responses. These analyses confirm a continued improvement in the secondary endpoint of overall survival, with a 30% reduction in the risk of death when patients were treated with the combination. Significant improvements in both progression-free survival and objective response rate were shown to be sustained with the combination within this extended follow-up analysis, with a median PFS of 16.6 months versus 8.3 months, as well as overall response rate of 55.7% compared to 28.4%. And importantly, the complete response rate for the combination, which is something that we know that it has a relation with the overall survival, was shown to increase with extended follow-up with 12.5% of patients achieving a complete response with the combination compared with 5.2% for sunitinib. Yeah, the safety profile identifying the CheckMate 9ER trial was consistent with that previously reported observed with Cabozantinib and nivolumab, and no new safety signals emerged in this extended follow-up. Yeah, so that's important because for people living with advanced renal cell carcinoma, the current survival rate is around 12%. So there has been a dramatic evolution in the treatment landscape across lines of therapy for people living with renal cell carcinoma over recent years. So this is an exciting time to be a treating physician in this area. And these new data showcase the possibilities we can offer patients for their advanced disease, presenting the opportunity to live longer, and some patients even achieve a complete response whilst maintaining their quality of life. While length of survival should be the priority focus and decisions should account for maximum efficacy, of course, patient preferences, which may constitute a significant impact on person's quality of life, should also be considered. These complementary presentations underscore the growing need for treatments which provide the strength of efficacy whilst maintaining quality of life for patients, as we are starting to see a trend of people living longer with cancer. In a separate analysis with 32.9 months median follow-up, patients continue to report clinically meaningful quality of life benefits with the combination of cabozantinib plus nivolumab as compared to sunitinib. These exploratory outcomes were measured using the Functional Assessment of Cancer Therapy Kidney Symptom Index 19, which assessed quality of life associated specifically to kidney cancer, as well as the EQ5D3L instruments, which assessed quality of life more generally. Quality of life scores from these instruments were found to be improved or maintained over the time amongst patients treated with the combination, while reductions in scores were observed with sunitinib. And additionally, those who received the combination were 48% less likely to be notably bothered by treatment side effects than patients in the sunitinib arm. So these updated data follow the publication of 23.5 months median follow-up quality data are published in the Lancet Oncology from January 2022.